I'm here to tell you a little bit about my story and how I got here. But before I get started, I need to just sort of start by saying, if you don't know, I do research with quality and safety process improvement, and if you know that area, then you know I could have a whole lot 8x10 color glossies with lines and circles and arrows on the back and bore everyone to tears. And as I got ready for this talk, I had all my 8x10 color glossies set up, and I was ready for this incredibly dull, boring, non-riveting talk. And I looked at last year's talks, 2 years ago, and I saw this talk by Katrina, and I was like, that is so funny. So I want to give her a shout out about giving me the inspiration to not be boring tonight. So I'm going to try to not be boring. Thank you very much. So this is my journey. It starts in Edmonton. As I said, it's an insidious plot. We are taking over Calgary one Edmontonian at a time. Well, the journey's going to go to Manitoba and have a decade of Winterpeg. And then it's off to State College, Pennsylvania, Birmingham, Alabama, and back here to the motherland in Calgary. So my background is kind of varied. Before I got into academics, I was working in the corporate sector for a long time. I was in management. I did training, consultant, marketing, operations. Loved all that. That was great. I got a hankering to be a physical therapist, so I did my undergrad degree at U of M, so I'm a PT. Had an awesome practice at the St. Boniface Hospital. Loved doing that. But these two areas are for me, very synergistic and very integrated, and I wanted to think about healthcare with my management lens because I had a decade of that, and I kept thinking, I know I can make healthcare more efficient, more effective because I know how to be a good leader. So I got this inspiration to go do my graduate education, and I decided I'm going to go to university. And clearly Harry Potter is a common theme tonight, so unfortunately I didn't get to go to that university. I went to this university, which... I don't know if you know that green Slytherin look of the Manitobans, but so away to Winnipeg, and again, I lived there for decades, so I can say that. So away to Manitoba I went. I did my MBA at the Asper School of Business, and I did my PhD in org behavior, which is psychology in the workplace. Did a minor in knowledge translation, which is kind of cool because who knew at the time it was going to be such a relevant part of my career. And then as I was working through my graduate studies and thinking about what do you want to be when you graduate, and what research area do you want to be passionate about? I got hurt as a care provider. So I was working as a PT in the ortho ward, and I had a patient that decided she wanted to have a fall, and I knew my surgeon would murder me if that happened. So being the heroic PT, I sacrificed myself for my patient. And the moral of that story simply was it changed how I thought about injury in the workplace. And I started thinking about people get hurt in the workplace, and I started looking at stats, and this is a 2014 number, but I started looking at the injury rates in healthcare, and I was shocked to find out, as you can see here, healthcare is the highest injury rate industry in Canada, and it's actually among the top 3 in the United States. So in North America, if you work in healthcare, you're more likely to be the most injured probability of any single worker in any industry in the continent. Now, these particular numbers show that healthcare workers make up about 17 to 20%. That number's been consistent for over a decade, but 1 in 5 injuries that happen and these are only, just for your information, these are only claims injuries. These aren't people that get hurt at work and go back to work and there isn't a claim. So that's a pretty shocking number. So I took on the passion of safety culture, and I wanted to understand what makes a place safe for a care provider to give good care. So I wanted to think about caring for the care provider. And I went down to Penn State University, which is a really amazing place to be, and I spent a whole lot of time, up through my tenure time, learning about safety and safety culture, and I found that it's a village. Everybody thinks sometimes safety culture is so simple. It's not. It's people, it's supervisors, it's training, it's supplies, it's the time of day, it's the shift I'm on. It's what kind of previous shift I've had. Have I been hurt before? So I was spending a lot of time becoming a very knowledgeable researcher in the realm of safety culture. And about the same time, remember, I'm living in the United States. We're in the late 2000s. The Affordable Care Act passes in the United States. And for those of you that are either from the U.S. or have lived there or follow U.S. politics a lot, you'll know that's a groundbreaking moment in 2009. But where this becomes really relevant for me and research is the Affordable Care Act set up the capacity for the Federal Payer Center for Medicaid and Medicare to introduce value-based purchasing. And that was executed in fiscal year 2013 in the U.S. And essentially, CMS basically shifted a portion of payments in healthcare systems from fee-for-service to fee-for-performance. And performance was quality and safety indicators. So all of a sudden, in the United States, all these healthcare systems were having to report on quality and safety, and quality moved from the back office the quality assurance risk management group, to the front office of, we really don't know how to do a lot about process improvement. So I was very fortunate. It was fortuitous timing. This College of Engineering at Penn State started a Center for Healthcare Organizational Transformation, and I got to hang out with engineers for 5 years, and they're a really cool group of people to hang out with. And I learned the science of process improvement. So the mechanisms and the tools, and I thought safety culture was really complicated, and I found out that in quality improvement, that village is even bigger. So the toolbox you carry for that is enormously large. And I spent time learning from my engineering colleagues to think about workplace and safety and quality from a process level. So I moved from the micro org behavior level up to the meso systems level, and I started thinking about how do we create systems that allow our care providers to optimize what they're doing so those outcomes are really awesome for patients and for families, and also for care providers, because coincidentally, most of the antecedents that create the great environment for the provision of care are the same antecedents that create the great environment for the care provider and the care providing team to be optimized. So I created these, for me, these like really amazing tools. I got tenure. I was really excited. I had this toolbox of safety culture and this toolbox of quality improvement, and they're really, really heavy. And I thought, what am I going to do with these toolboxes? And then 2014 came along, and the University of Alabama at Birmingham knocked on my door and said, there's this new field in graduate education in quality and safety, and there's 4 programs on the continent. We want to be number 5. Would you be our director? Would you lead it, build it, and if you build it, they'll come? And I said, yeah, what an exciting opportunity. So I took the toolboxes down to Birmingham in 2015, and I had this chance to start this program. So I built a graduate program, graduate certificate program. Super exciting experience. I mean, it's something to say when you're at the front end of a field of education. It's something I'll have all of my life. I'm incredibly excited. You know, I was there for the first graduating class, and I got to partake in that grad, and that's, you know, for me, I get goosebumps. And So I took all of these skills and I operationalized them into competencies in education and how people thought. And so still in the middle of that, it was thinking about, remember, the Affordable Care Act, value-based purchasing, quality and safety are metrics that count. And these were giving competencies and skills to providers and administrators that they really, really needed. And so you would think, Affordable Care Act, value-based purchasing, we see improvements, right? And sadly, in healthcare quality and safety outcomes, we don't anywhere in the world that's recording it. And so the last study that came out a couple of years ago said, you know, in studying the incident rates in the United States, that medical error is the 3rd leading cause of death. It was the 8th leading cause of death when the Institute of Medicine did their groundbreaking report in the 90s. So that imperative to care about fixing the systems and processes we have to optimize outcomes for our patients still exists. You all in this room, I'm sure, know the Canadian Adverse Event Study. You know, 1 in 18 people go into a hospital in Canada. In 2004, is that number higher or lower? If you look at the American stats, it would suggest it's probably a scarier number today. Healthcare Quality Council of Alberta said 14% of people admitted in hospital in Alberta were experiencing an adverse safety event in 2015. So that says that we're not making great progress. So we still have that moral imperative, which is okay. We know about it. That's really important. We also have a financial imperative. So if you think about, remember I started in the land of occupational safety, and I said, how are our care providers doing? If you look at the costs this year, $27 billion in costs for workplace injuries. If you figure out the 17% of occupational health injuries, that's about $4.5 billion Canada will spend this year for injuries in healthcare. Add that into another $2.75 billion that we'll spend for injuries and patient safety events this year as well. So that's a lot of billions of dollars that are going into the area of patient quality and safety. And obviously there's a need to improve it. And that's sort of what my passion is and what I do and what I love. So fast forward to last summer, my partner and I got an opportunity to be recruited back here. This is the motherland, so it was very exciting. It's like, Canada, it's a no-brainer after 2 years in Alabama. My apologies. If you're from there, my apologies, but if you're watching the news, you'll get why I said it's a no-brainer to move back. So we answered the call, we came back, and here I am. I'm really excited to be starting this new phase in my career. It's exciting to be looking at quality and safety and looking at my 2 toolboxes and The research I'm doing now is I'm working in support with different people who are starting studies. I'm actually working with 3 different physician groups to look at different ways to improve care outcomes across a variety of platforms. And what I'm trying to do is bring really 2 things that have always been the hallmark of what I do. One of them is care. And I started out as caring for the care provider, and today it's caring for people. And everything I do, you know, wrapped inside a triple aim thought is, if you don't care what's happening, it's just not the right place, and we're not excited, and we have to care. So for me, this is a hallmark of what I do, and it's a passion for me. And the other part is leading. It's leading change. It's daring to be different. It's daring to do QI in a different way. It's helping people who are looking at, Dr. Eliana Castillo's trying to do a program to increase the uptake of influenza vaccinations for women who are pregnant, and it's looking at how do you find different ways to get the staff on board with that, and to encourage women to understand that that's an important thing for them to do for the care of themselves and for their unborn child. So daring is really, really important to me, and I think it's part of leading a great team and leading great QI efforts and thinking about those numbers and those imperatives of why we have them. I think that dare is important for all of us as researchers. We need to dare to lead, and we need to be innovative and different and creative and have the voice that people need us to have. So those are my pillars. I'm hanging out downstairs in W21C, so if you're looking for me and you want to have some fun doing some really cool research, I'd love to partner. And like I said, I'm doing some really cool studies with people. Fiona and I are going to build an empire. We're really excited about it. I'm not going to tip our hand today, but we're excited. We're planning to build an empire of really cool quality and safety outcomes. And in keeping with the theme of this, clearly within the School of Medicine, if we can't figure out a way to save it, here's my hockey reference, we can all read this book, How Hockey Can Save Healthcare. No, I'm not. I haven't read it. I found that, and I went, what? Really? But no, really. The reality is I just want to do a shout out because it's the 100th anniversary of the NHL this week. and nobody needs to notice that incredibly Edmontonian picture on the left-hand side. So I just want to wrap up and say thank you very much. One thing, if you do know me, and I did promise a couple people, I have a new puppy and I'm obsessed with my dog, but I said I wouldn't do a presentation about my dog. So I thought I'd close with my first favorite dog. If you know the Tintin series, you know who that is. So that's always at the end of the books. So I just want to say thank you very much. I'm trying not to obsess about my dog. So there's Malou saying, we're fin. Thank you. And I'm kidding, I had to put my dog in. This is Jackson, and I'm obsessed with him, so I just thought I had to put his picture in.
And she does talk about him all the time. So thank you, Deirdre. A huge skill set that she's bringing to the department, and has tons of great ideas, so we're looking forward to all the great things that you're going to be doing.